what if a simple tweak during surgery could determine whether a newborn lives or dies?
Mm.
We're going deep into the world of congenital hypertrophic pyloric stenosis today.
HPS.
HPS, yeah.
Right.
It had a heartbreaking 80% mortality rate back in the day.
It did, yeah.
A journey from a medical mystery to, well, a surgical triumph. You ready to go back a century?
Absolutely. A true testament to how medicine can innovate and persist, you know.
For sure.
In the early 1900s, it was a nightmare
Yeah.
for both parents and doctors, imagine. Just weeks old.
Oh, gosh.
And the baby's just racked with forceful projectile vomiting. And they can't keep anything down.
It's heartbreaking to even imagine. It must have been just a feeling of hopelessness back then.
Oh, it absolutely was, yeah.
Yeah.
But even with that desperation, there were some who refused to give up.
Yeah.
You had doctors like Alfred Munch, and he really meticulously documented everything.
Oh, wow.
The telltale signs, the forceful vomiting we talked about,
Right.
the palpable olive in the abdomen, and then just the alarming weight loss.
Of course.
Were really crucial observations because it finally let doctors distinguish HPS
Yeah.
from all the other things that can cause vomiting in infants.
So they were starting to understand it. I mean, they had a name to this mysterious illness.
They did. They did.
But knowing what it is doesn't necessarily mean they knew how to fix it, right?
Right.
Like, what was the next step?
Early surgical attempts, very daring, but also often disastrous.
Oh.
Surgeons, real pioneers like Nicole and Mayo,
Wow.
willing to operate despite, immense risk.
Yeah.
But the lack of understanding the anatomy and physiology, that was a big problem.
Right.
Meant that success was really elusive.
And a lot of complications.
A lot of complications, very frequent, yeah.
So it's like bravery and frustration all at the same time.
Absolutely.
They knew they had to do something,
Right.
but they just didn't have the knowledge or the tools yet.
Right.
So when did the turning point happen?
The 1910s.
Okay.
That's when things really changed.
Yeah.
And it all started with a pretty simple incision.
Yeah.
Konrad Ramstedt,
Okay.
German surgeon, and his technique would change HPS treatment forever.
Hmm.
It's called the pyloromyotomy.
Okay.
And the genius of it,
Yeah.
instead of removing tissue,
Okay.
Ramstedt made a very precise incision.
Okay.
It was longitudinal along that thickened pyloric muscle.
Okay.
Now, this released the constriction,
Right.
but without actually creating a full opening in the stomach.
Okay.
So it minimized the risk of leakage and infection.
So less invasive, but did it work?
Oh, it did.
Okay.
And I mean spectacularly.
Wow.
Ramstedt's pyloromyotomy, it was a total game changer. Mortality rates just plummeted.
Wow.
It transformed HPS from a near certain death sentence
Oh, my goodness.
to a very treatable condition.
That's amazing. So one man's ingenuity saving countless lives.
Absolutely.
But even then, surgery on infants, especially back then, can't be without risk.
Oh, of course not, no.
Were there still challenges even with this amazing new technique?
Absolutely,
Well,
yeah.
Okay.
Even with Ramstedt's technique,
Right.
surgeons, they were still dealing with the complexities of operating on such tiny patients.
Of course. Yeah.
And the metabolic disturbances that came with, all that vomiting,
Right.
especially electrolyte imbalances,
Yeah.
that was a big threat.
So it's almost like they were trying to fix the boat while it's still sinking.
Yeah, exactly.
Exactly. So they had to address those underlying issues before surgery could even be a possibility.
They did.
Okay.
1920s, pioneers like Rav Singh and Abbott, they recognized how important meticulous pre-op care was. They developed these tailored fluid regimens
Right.
to correct the electrolyte imbalances,
Right.
essentially stabilizing the boat right before patching the hole.
Yeah, that makes sense.
This shift to a more holistic approach,
Yeah.
recognizing the importance of both surgical skill and preoperative optimization, really further improved outcomes.
Well, that makes sense.
Yeah.
But even with all this, even with a pretty reliable surgical solution, I mean, diagnosing it must have still been a challenge.
It was, yeah.
To rely solely on a physical exam just seems a bit, I don't know, uncertain.
Right, yeah.
So what changed there?
So in the 1930s,
Okay.
another breakthrough. This time it was radiology,
Oh, wow.
X-rays, specifically barium studies
Okay.
that finally let doctors visualize
Oh, wow.
the elongated and narrowed pyloric channel so they could confirm the diagnosis with visual evidence.
So no more relying on just feeling for that olive in the abdomen. They could actually see it.
Exactly.
That must have been a huge relief for doctors.
Oh, absolutely.
And, of course, for the parents, too.
And for the parents.
Took away a lot of the guesswork.
It did. It was a big step forward.
Wow.
Pioneers like Hall and Wolf, they refined these techniques
Okay.
for using these barium studies in infants.
Okay.
And that made diagnosis faster, more accurate, worse.
And therefore led to earlier interventions.
Which, of course, prevents complications and helps the outcomes.
Exactly.
Wow, it's amazing how each advancement kind of builds on the last one.
It does.
This cascade of progress. It makes you wonder what those early pioneers would think if they could see how far we've come treating HPS.
I think they'd be amazed. But the story isn't over yet.
Oh.
As the medical community got more confident in diagnosing and treating HPS,
Yeah.
they started to ask a new question.
Okay.
Why?
Why does this happen?
Why does this happen? And that's when things get really interesting.
Okay, let's hear it.
The mid-20th century, that's when the focus kind of shifted
Okay.
from fixing HPS to really understanding what causes it. Scientists weren't content with just treating the symptoms anymore.
Makes sense.
They wanted to know why some babies got it and others didn't.
It's like solving a puzzle. You've got all the pieces, but how do they fit together?
Yeah.
To see the big picture. And one of the first pieces was genetics. It played a big role.
Okay.
Carter, back in the 50s, his studies showed the familial patterns.
Right.
It was much more common in boys,
Okay.
and it tended to run in families.
So it wasn't just random. There was something in their DNA that made them more susceptible.
Exactly, a genetic predisposition.
Wow. But genes don't tell the whole story, do they?
No, they don't.
There's got to be more to it.
Environmental factors, they came into play too.
Okay, so it's nature and nurture, both genes and environment,
Right.
shaping a baby's risk. What kind of environmental factors?
Well, large-scale studies, like the ones Honey did in the 90s,
All right.
found these interesting connections between maternal and, things happening around birth.
Right.
And the rates of HPS. So things like birth order, how they're fed, even medications during pregnancy.
So a baby's risk could be influenced by things happening before they're even born.
Absolutely.
That's kind of wild.
Yeah.
But proving those connections definitively has got to be difficult.
It is. It is a challenge.
Yeah.
These are complex, multifactorial relationships.
Right.
You have to be careful.
Yeah.
Analyzing and interpreting data, cause and effect isn't always clear.
Right.
But even identifying those potential risk factors, that was a big step.
Like having a checklist, right? Doctors can look for these things.
Yeah.
And maybe identify babies more likely to develop it earlier.
Exactly.
Okay.
But then remember those macrolide antibiotics we talked about?
The ones sometimes given to infants?
Like erythromycin?
Yeah, erythromycin, right.
Researchers made a really surprising discovery that added a whole new dimension to the story.
Okay, what about them?
Studies, late 90s, Kuna and Peterson found a possible link between early exposure to these antibiotics and a higher risk of HBS.
So you're saying giving a baby antibiotics, something that's supposed to help them,
And
could actually increase their chances of developing this serious condition.
it seemed counterintuitive.
It does.
But the research, it pointed towards the gut microbiome, especially in newborns.
Right.
That balance is so delicate.
Yeah.
And disrupting it, even with good intentions, could have unintended consequences.
So like a domino effect, you intervene in one area.
Yeah.
It triggers this whole cascade of events.
Yeah.
Unforeseen outcomes somewhere else in the body.
Exactly.
It just highlights how interconnected our systems really are. Did other researchers confirm that link?
They did, yeah. Lots of studies.
Wow.
A big one, the Danish cohort study by Sorensen, it really reinforced that connection.
Okay.
It sparked a whole new wave of research into the gut microbiome's role in infant health. And people really started reevaluating antibiotic use.
Wow, that's powerful scientific discoveries challenging conventional wisdom.
It is.
And changing how we practice medicine. So we've got genetics, prenatal factors, early antibiotic use, all contributing to this HPS puzzle. But were they able to figure out how these factors cause the pyloric muscle to thicken?
That's the million-dollar question. The underlying mechanisms, they remained a mystery for a while.
Okay.
But as we entered the 21st century, new tools, new technologies allowed scientists to go deeper into the molecular mysteries.
So we're talking gene mapping, DNA sequencing, all that.
Exactly.
That's when things really took off for understanding the genetic basis of so many diseases.
It is. And researchers like Everett, they use linkage analysis. Really sophisticated techniques to pinpoint regions on chromosomes linked to HPS susceptibility.
So they found the genetic hotspots. the areas in our DNA that might hold the key to understanding HPS.
Exactly.
Were they able to find one single HPS gene?
It was more complex than that, unfortunately. No single gene was responsible. It was a cluster of genes working together. Their expression influenced by those environmental triggers we talked about.
It's that dance between nature and nurture, genes and environment.
It is.
All shaping a baby's risk. What a fascinating but complicated puzzle. What else were they able to find as they dug deeper into those molecular workings?
Some clues came from studying the nerves in the pyloric muscle. Researchers, Firth and Kelly, they discovered abnormalities in how certain signaling molecules were expressed, specifically nitric oxide synthase.
Remind me what nitric oxide synthase does. It rings a bell, but I need a refresher.
It's the enzyme that makes nitric oxide. And nitric oxide, it relaxes smooth muscle.
Right.
The muscle in the pylorus.
Got it.
It's a signal for the muscle to chill out.
Makes sense.
But if that enzyme isn't working right, the muscle doesn't get the message, and you get overgrowth and constriction.
Which is what happens in HPS.
Exactly.
So it's not just the muscle itself.
Right. It's those signaling pathways controlling it.
Yeah, those signals get scrambled, the muscle goes rogue.
Fascinating.
It's a delicate balance.
So by the 2010s, we've got a pretty good grasp of the genetics, the potential environmental triggers, even some of those molecular mechanisms. What about treatment? Anything new on that front?
The fundamentals, they haven't changed too much. Early diagnosis, fluids, electrolytes, surgery. But the focus shifted. Refining those techniques and addressing global disparities in care.
So it's not enough to just have the solution. Everyone needs access to it.
Absolutely. One area was validating laparoscopic pyloromyotomy. Large studies, like Mizumi's thousands of patients, confirmed the minimally invasive approach worked just as well.
Great.
Fewer complications, faster recovery.
It's always good to have that large-scale data to back things up. It helps solidify those best practices, but even with a well-established, effective treatment.
There's always room for improvement, right?
Oh, absolutely.
What else were they working on?
Optimizing the whole patient journey, from suspicion of a diagnosis all the way to post-surgical care.
Makes sense.
Garaiba and Baird, they showed early detection. And quick surgery meant shorter hospital stays, lower costs, fewer complications.
So it's about making the whole process as efficient and patient-centered as possible.
Exactly.
Especially when you're dealing with anxious parents and their babies. But even with all this progress, I imagine there are still challenges.
Oh, there are,
Especially in places where access to healthcare is limited.
Absolutely. In the 2010s, there was a growing awareness of global disparities. Researchers like Sirota, they use those international registries to analyze how things varied. Incidents, treatments, outcomes across different countries, ethnic groups.
So acknowledging that not everyone has the same level of care. It's a sobering thought.
It is. But that awareness led to action.
That's good.
All these initiatives launched to improve surgical training globally, how resources were allocated, access to timely diagnosis and treatment.
That's really encouraging to hear. It's a reminder that medical progress isn't just about big discoveries. It's about making sure those benefit everyone, no matter where they are.
Absolutely. Equity and accessibility.
So as we wrap up this part of our deep dive, it's a sense of hope, right?
It is.
Solid understanding of HPS, safe and effective treatment, and this growing commitment to equitable care worldwide. But I'm guessing the story doesn't end there.
Not even close. The most exciting chapters, they might just be beginning. In our final segment, we'll look at the cutting-edge research from the 2020s and beyond. Personalized medicine, maybe even non-surgical interventions. And potentially preventing HPS entirely.
So we've gone through a whole century of HPS breakthroughs, from, desperate uncertainty to this life-saving surgery. But you were hinting at something really groundbreaking happening right now. What's on the horizon for HPS treatment?
Imagine a world where we don't just treat HPS. We predict it, maybe even prevent it.
Wow.
That's the promise of the 2020s and beyond. Personalized medicine, that's where it's all headed.
So how do we get from scalpels to personalized predictions for HPS?
Every baby's got a unique genetic code, right? It's a blueprint that influences their health. Researchers, Rauschio and Pakarinen, they've been identifying gene combinations
Okay.
that, when they're mixed with certain environmental things, really increase the risk of HPS.
So it's like a personalized risk assessment for each baby.
Exactly.
But what do we do with that information? Even if we know a baby's at high risk, can we actually stop that muscle from thickening?
That's the exciting part. We're shifting from reactive treatment to proactive intervention.
Okay.
One way is close monitoring, ultrasound. If the muscle starts thickening too much, we might be able to intervene before it totally blocks.
So watchful waiting, but with really advanced technology to help us decide.
Exactly.
What kind of interventions are we talking about?
Now things get really interesting. Researchers are looking at non-surgical options.
Okay.
Maybe medications that could relax the muscle, even reverse the thickening.
So treating HPS without surgery.
Imagine that.
That would be amazing. What kind of medications are we looking at?
One thing is nitric oxide donors.
Okay.
Remember how nitric oxide relaxes smooth muscle?
Right, yeah.
If we can get it right to the pyloric muscle, it might help counteract that constriction.
So we're targeting the molecular pathways that control the muscle.
Precisely.
Precision medicine at its best. What else is out there?
Another possibility, smooth muscle relaxants, kind of like what we use for asthma.
Oh, okay.
Ease the spasm, let food pass through easier.
It's amazing how we learn from other areas of medicine and adapt the tools we have.
Yeah.
But are these non-surgical treatments effective in babies?
It's early, but the initial results from animal models and small studies look good.
Okay.
Larger trials are happening right now to figure out safety and efficacy in infants.
It's exciting to think that HPS might be managed with medication someday, or even prevented.
It is.
But what about those who still need surgery? Any advancements there?
Definitely. Alongside those new treatment possibilities, there's a global effort to make surgical training and access better. Researchers, Karpolowski and Party, they've got these innovative programs using online platforms, telementoring, simulations to train surgeons in laparoscopic pyloromyotomy, even in remote areas.
So making sure that every child with HPS gets the best possible care, no matter where they are.
Exactly.
That's incredible. What a deep dive this has been.
It has.
We went from a really scary diagnosis to a future full of hope.
Yeah.
Who knew a simple muscle blockage could lead to so much innovation?
It's really a testament to human curiosity, that constant search for better solutions.
Yeah.
Meticulous observation, groundbreaking surgery, that complex interplay of genes and environment. The story of HPS shows just how powerful medical science can be.
So listeners, if you're intrigued, dig deeper. There's so much information out there. This journey, it's not over.
Not at all.
Who knows, maybe one of you will contribute to the next chapter of this amazing story.
Absolutely. Keep asking questions.
Yeah.
Keep learning, push the boundaries. The future of HPS, of all medicine, really depends on it.
Thanks for joining us on this deep dive into the world of HPS. Until next time, keep exploring.